What's up, everyone? Welcome back to another episode of Kind of Different, a podcast where we talk about innovation in dental care. We connect with absolutely amazing guests and dentistry leaders, thought leaders, just people who are really pushing the profession forward. And then we talk about how we all together can make dental care more human. I'm Dr. Matt Allen, CEO and co-founder of DifferentKind and your host for Kind of Different. And today I am super excited to have with us Dr. Tina Saw, who is the CEO and founder of Oral Genome, which is a really cool platform that I'm excited to have her share more about and what they do and how they are innovating in the dental space. But Tina, thank you so much for taking the time to join us today. Why don't you go ahead and introduce yourself to our listeners and your company, and then we will go ahead and get into it.
Perfect. Well, thanks, Matt, for having me on. My name is Dr. Tina Saw. I'm the CEO and founder of Oral Genome. I'm a dentist, been in dentistry for over 16 years. And what we do at Oral Genome is point of care dental saliva testing. We help people with early disease detection with a test that they can run themselves either at home or in the dental office.
Awesome. That is a very concise, I think, and easy to understand description, which is great. It sounds like you probably worked on that, which is awesome. Yeah, tell us a little bit more, because I think that this is obviously something that, as a patient might be new to. If I walk into my dental office and they're like, hey, here's this thing, like, how does that work? What does that look like? Give us a little bit more insight there.
Yeah, so I really believe that we really should be helping our patients with better at-home prevention plans.
Mm.
And I was looking at medicine, and there was a time where I was really ill and I couldn't figure out why. So I went to the doctor and they did some blood testing on me. And they were able to look at these biomarkers in my body and understand like what really was going on. And I was like, why are we not doing this in dentistry? And I thought, yeah, there's a lot of mail in and mail out saliva kits out there, and then you bring the patient back. But what if there's a way that we could get results really quickly and to be able to get better at home prevention plans and better insights into what's going on in your dental health? So that is why I started embarking on the journey to formulate Oral Genome.
That's super interesting. And I think, yeah, like to the point of most of the markers in dentistry that we look at in terms of disease, right, are after the fact, right? So you actually have a cavity, not you're at risk for getting a cavity, or you have some things that, we're learning that, might put you at risk for getting a cavity. So, are there specific things that, helps patients walk away with? Like, what is, if you were coming in and a patient, was interacting with an oral genome test, what are they walking away with, and what does that interaction look like with them and the provider?
Yeah, so when I built the test, we really thought about the consumer experience with
Mm.
everything. I think that saliva, there's a lot of biomarkers out there, and if you really have to dig deep as a dentist inside and think about your dental school training and what those biomarkers were, what those recommendations are. And so I really thought about how can we simplify the process. So I looked at companies like 23andMe, I looked at
Mm.
Ancestry DNA, and I was like, how do they simplify, and Everlywell too, how do they simplify lab reporting? And that's exactly
Mm.
what we did. So when you walk through the mobile app that we have built out, it essentially is we're measuring your biomarker, we're telling you the level of it, we're telling you your risk level for the specific disease. We're connecting it to the oral systemic health, and we're connecting it to very tangible recommendations that you can do at home. We also coach the provider too and tell them, hey, here, this person is at a risk for periodontal disease. They probably have periodontal disease. Let's take a deeper look. And then we're also reaffirming that diagnosis for the provider at that point. So that's essentially what we do.
Awesome. I love that. Obviously, you see, as we talk about innovation in this space, right, just in dentistry in general, not specifically like, with oral genome, which is obviously very innovative. But when you kind of think about this, it sounds like, and forgive me if I'm reading too much into this here, but it seems like you think that especially the prevention aspect of the dental ecosystem is ripe for change. If you agree with that, maybe share more. If you disagree with that, maybe tell me why, and what you think, where you think kind of an area that is in the dental ecosystem is ripe for innovation.
Yeah, exactly. And I think that a lot of innovations in dentistry have been on the restorative care, have been on the reactive care. We're looking at x-rays all the time. We're seeing like what's already happened. I believe I read a statistic somewhere that It takes over 40% of bone loss to happen on the x-ray for us to be able to see that it's already happened. By then it's too late. When you think about it, as dentists, we're feeling, tactily feeling the holes in the tooth and the softness, and then we're treating those cavities. But what if we're able to get them on a good prevention plan before? You're actually bringing more patients into the chair that way because you're bringing more trust. And so that's what my vision is, to really innovate in the prevention space. We really need to be more about whole care as providers. We can't just be the ones fixing things. We really, like, that's why we all went into dentistry, is to be able to help people and help them achieve a healthier smile and a whole health, and be with them on this long-term health journey.
I love that. I mean, I think that's so very important. Obviously, you learned from other industries in this. As you kind of went through this, you mentioned 23andMe and several other companies there. As you think about what other health tech innovation has done really well, how has that informed your journey, both as just a founder and as Oral Genome as a company?
Yeah, I mean, I spend a lot of time, I think because I've also had health issues, is I spent a lot of time in medicine. I like to hang out, like looking at the optometry space, the chiropractic space, because I think that every single field has their own type of thing, a way of doing it. And I figured, if I look in outside industry and bring in the best of what they have, I could do anything. And so that's what we did.
I love it. I love it. Yeah, there's so much out there that's happening that's beyond the walls of a dental office or even our profession, right? That I think we can bring in, and it sounds like you've actively been able to do that, which is really cool. Great. Let's learn a little bit more about you. I think it's always super interesting to talk about products and talk about things that we're building and whatnot. But we are all people behind those companies and those products. So I want to learn a little bit more about you. I think especially as founders, oftentimes, and rightly so, right? Our vision and our values should be reflected in our company. So just walk us through a little bit more about how some of who you are is reflected in the company that you're building.
Yeah, I mean, I think who I am, I mean, I'll give you a little background, is that I'm a mom of two. I have a 6-year-old and a 5-year-old. And I think part of what I founded Oral Genome is I actually do believe that everyone has different risk levels for different things. And, I was always that parent too who would, um, before, I will fully admit, like, this is so embarrassing, but I would have parents come in to my dental practice, and then they'd be like, they they would be like, the kid would have a lot of cavities and another kid wouldn't have cavities, and it just, and then I was like, well, that mom is just, I was a judgy mom, like in my head as a dentist, like, oh, they're, maybe not taking really good care or not feeding the kid right or doing all that stuff. But then when I became a mom myself, and I had two children, and I noticed that, my son had more cavities, my daughter had perfect teeth,
Mm-hmm.
like I knew there was something going on. So that's where I started thinking, what if we can measure these biomarkers, rebalance them, and come
Mm-hmm.
up with a plan that was individual to each child or each person. Um, yeah, so that's kind of a little bit about me. I'm always really just thinking. I have this really strange thing where, like, I see things that are happening in private practice or around in the world, and I just find this thing like, oh, there's got to be a better solution. There's got to be a better mousetrap. And I kind of just stay up thinking about it and just trying to bring solutions. For me, I'm a dentist, just a dentist. I mean, I don't have any other experience, but for me, it's finding the right people and bringing them all together to help me really embark upon my mission.
That's awesome. And as you think about that, then kind of crafting of team and doing those things, are there specific values that drive you personally, right? Of whatever those might be that you are already instilling in your team or hope to instill in your team over time. Like what does that look like for you in terms of what values drive you and how might that be reflected in your work as well?
Yeah, so when I was building my team for Oral Genome, I was looking for people who really believed in the mission, like they believed it 110% and
Yeah.
subscribed to it. One of the things that we do at Oral Genome is we help underserved communities, such as those in the IDD, the foster care population, people in the rural health who cannot necessarily get to the dentist. We're really increasing the health equity and access to care by be able to provide personalized health at a really affordable manner. So
Mhm.
for me, bringing in those team members was people who believed in helping other people.
Mm.
They weren't there just to make a paycheck or get their pay on what we're doing. They were the people who are on my team right now are people who are not just going to do their job technically, but they are going to push forward in some sort of partnership or some sort of health coalition to be able to bring
Mm.
this to areas where people need the care the most.
I love that, and I think that obviously, building a company that's focused not just on, profit certainly, but not just even on patient, overall patient outcomes, but focusing on where the marginalized communities might be experiencing more challenges. And we all fall into some of those realms, right? Like it's not, hey, I am only in this one community, right? Like I live in a very rural area, and certainly the lack of care here can be a challenge sometimes, especially specialty care. And so, I think that that's a really important way to think about, especially in the early days of building a company. And so I love that you're focused on that. It's amazing. Awesome. Well, let's talk a little bit then in terms of, I think that, well, actually, I have one more question for you, and just to learn a little bit more about you. I was recently booking a meeting with someone on Calendly, and I loved this question from them. They were like, "What music have you been listening to recently?" And I was like, "Oh, what a cool way to learn more about someone, right?" And that's how they had operationalized that. So maybe you could just share with us, some music you've been listening to, a book that you've been reading, something that's been, inspiring you creatively recently. Would love to hear more from you there.
I have been actually reading this book recently about harnessing your anxiety for leaders. I bought the book on Amazon. Oh, I'm gonna have to look up exactly like where. Give me 1 second.
Yeah, totally. Let us know.
Yes, it's called The Anxious Achiever. Turn your biggest fears into your leadership superpower. So I think as a founder, what I found, which I didn't really realize going into this journey of building Oral Genome, because as a dentist, I had my own problems. In practice, it was like team member problems. Someone called in sick, patient didn't show up, insurance didn't pay on a claim, et cetera, and stuff like that. And then as I started building Oral Genome and as I started bringing partners into the situation and started going, like looking at all the deals that were on the table and people who wanted to bring our technology in, I think there is also something like, I guess in dentistry and when you're in dental school. So when you're in dental school, you get your score right away from an exam, like the next day it was done and you like were satisfied. In your private practice, you saw your patients 8 to 5, you were done with your day. Maybe someone would call on call or have some pain, you call in medication. But I feel like in the startup life, what I didn't realize is how long it would take when you are establishing relationships and finding your way and finding the right partners. Nothing happened overnight. And so it caused a lot of anxiety in me. And I became, I would say, the anxious achiever. And I was reading this book and I realized anxious achievers are people who have this high drive need to succeed and they won't sleep and they will just keep going and going. But sometimes that anxiety of not knowing can drive them crazy. So how do you control that anxiety and put it into your superpower? And so I'm learning that all right now because we're coming into a time at Oral Genome where it's exciting. We are launching our product very, very shortly. I mean, we're making some big partnership announcements in the next couple of weeks. But it's been a process for me internally to control those like feelings inside and look cool on the outside, I guess.
That's a great recommendation. I'm going to go definitely look that up. I have another one in that realm by a guy named Steve Kliss, I think is how you pronounce it. I've actually met him before, but it's called Managing Leadership Anxiety. So it sounds very similar in terms of that and some great like practical tips in there. So I think for leaders, it sounds like both of those are probably really good reads. So thanks for sharing with us what you're leading and how it's impacting your life. I love it. Which is obviously what we want from good books is they don't just, we read them and put them back on the shelf as they leave us changed. So thanks for sharing. Awesome. Well, let's talk a little bit about making dental care more human. And I think that obviously the title of this podcast is kind of different. And, how are you making dental care different, I would say? And I think maybe we can make some guesses about that, but I'd love to hear it in your own words. And then how do you see that making it kind? And maybe we've already talked a little bit about that too, but would love to hear kind of both of those things in your own words.
Yeah, at Oral Genome, we are really just decoding your mouth. We are building transparency. We are essentially being your oral health advocate. And we're doing it in a kind way because the thing is like we're non-invasive
Mm.
and we're telling you the truth and we're doing it in an objective manner. And really, our goal is to really help evolve with you and evolve recommendations based on your needs that keep changing in life. We're
Man.
there with you every single step of the way.
Yeah, it so reminds me of the Brene Brownism, clear is kind, right? And it sounds like you're providing a lot of clarity for people, which obviously can be very kind, right? So I love that. That's awesome. Um, Imagine, well, not imagine, right? We are all patients, and as a patient yourself, right? It sounds like you've talked about some of the health issues that you've experienced and some of the frustrations that you had, or some of the kind of light bulb moments that it set off for you. When you think about yourself as a patient, what experiences, other than the one that you've already described, which obviously led somewhat to what you're doing now, what other formative experiences can you share with us that left a mark on you that said, "Hey, this is how it should be," or "This isn't how it should be"? Would love if you could share, an experience or two there.
Experience, you're talking about experience in general in any healthcare industry of kind of
Exactly. Yep. And just as a patient, yeah, right. As we put ourselves into the patient's shoes,
oh, Matt, you challenged me. Um,
it's a good
one of
thing.
the
It's a good
things
thing.
that we don't talk about in medicine and dentistry is second opinions.
Mm.
It's something that, as a provider, we're really proud of our treatment plans and our diagnosis. We are taught to look at different things and we're taught to how to speak to a patient to close a treatment plan.
Mm-hmm.
But in medicine and dentistry, it's very frequent but not talked about that we go to different patients go to different providers sometimes because they just want to get a second opinion, make sure it's right, there's no overdiagnosis, this is the best way of treatment. And I think about the number of patients that have come to my chair and thought they were overdiagnosed with cavities at another office, or that they really didn't need that periodontal scaling and root cleaning or deep cleaning. And I think what we do, and as I mentioned before, is we're really reaffirming, we're providing that tool through a test
Mm-hmm.
that says, we're not saying, yes, you have cavities or yes, you have periodontal disease. We're just showing those markers that are saying, yeah, you probably do have those things. And we're saying, yeah, you probably should get treatment because it's not a lie. It really is what the test is showing. So I think I've kind of drawn that personal experience from being a provider in the chair, doing a lot of second opinion consults
Mm-hmm.
and understanding like, you know, what is it in a patient's head? And before I even formulated Oral Genome, I did a lot of consumer studies and people really saw us as the advocate, as that test who is really going to do a checkup on my dentist. And like I said, I didn't really like to talk about this publicly, but it's really how consumers do see things. And we have to face that.
Totally. Yeah. I mean, obviously we're in a much different realm than, back in the day where, people would just say, "Oh, you're the doctor, you know best," right? Like there's so much information out there. There's so much ability for people to read things and understand things. And in a really good way, I think sometimes that's viewed in a negative light, right? Of, "Oh, this patient was like looking on the internet." And it's like, "Oh, well, that's how we make all of our decisions." Like, unfortunately, and probably fortunately in a lot of ways, it provides a lot of that ability to actually have a conversation and not just tell patients what they need, right? But to understand what they want, to understand their values, how that might shape what the treatment plan can and should be, because we shouldn't be just making treatment plans for patients, right? We should be making treatment plans with patients and giving them options and helping them understand, how different pieces of it impact each other. So I love that. And I think that, yeah, you're right on, at least from my, opinion there. So thank you for sharing there. Awesome. Well, I mean, we could have tons more questions we could ask. We always try to keep it, within the realm of like, hey, one commute. I know you're in San Diego, and I know the traffic can be bad there. So maybe, it might be a longer commute for people there. But here where I live, it tends to be pretty short because we're in a rural space. So if people want to learn more, if they want to engage more with you personally or learn more about what you're building, tell us where they can go. Help us understand what it would look like to learn more.
Yeah. So we do currently have a landing page right now. It's called oralgenome.com. I will say I have shared a lot about what we are building here on this podcast.
Mm-hmm.
We will be releasing a lot more detailed information in a couple weeks. We are also, there's going to be, yes, just stay tuned, like on LinkedIn and things, because there will be a big release and press release of different announcements, who we've partnered with, and how we are impacting everybody and where we're going to be launching. So stay
Awesome.
tuned. Find me on LinkedIn. Send a connection request. Follow our Oral Genome LinkedIn page, and stay tuned for those big announcements.
Yes, and so usually we record a little bit before the release, so I don't know exactly when they're coming, but it's either going to be a lot closer to the release time, or that information might even be out. So yeah, depending on when you're listening to this, all of that news may be public, or at least it's a lot closer to being out in the light than it is at this very moment. So Tina, thank you so much for taking the time with us today. We're so appreciative of you, and really love to just have this insight into something that I'm guessing you're hoping, right, is going to impact every single patient in dentistry at some point or another over the course of their lifetime. So thank you for sharing this information with us, and thank you for just letting us know a little bit more about who you are. We really appreciate it.
Yes, thank you so much, Matt.